All right. Good morning, everyone, and welcome to United Way. Good afternoon. Let's start there. Good afternoon, and welcome to United Way of Southeast Louisiana Public Policy Committee Educational Session number 2 on health and community strengthening. We're so excited to have you all here today. We have a wonderful program lined up. We're going to give everyone a minute to join, and then we'll jump into housekeeping. If you'd like, please feel free to introduce yourself in the chat so we can see who's here today. And we'll take about 30 seconds and then we will get started. So once again, welcome to United Way of Southeast Louisiana Public Policy Committee's educational session on health and community strengthening. Okay, so let's jump in with a few housekeeping notes. This session is being recorded and will be shared with all registrants after the presentations, and we will also share any slide decks as well. We ask that you submit your questions during the program using the Q&A feature, and using that feature will help us keep track of the questions and make sure that we don't lose anything in the chat. And all of the questions will be addressed at the end of the session. So we'll have time for questions and discussion at the end after all of our presenters have shared. And with that, I'm going to pass it over to Ron McLean, United Way of Southeast Louisiana Public Policy Committee Chair.
Hi, good afternoon, everyone. As Mary said, I'm Ron McLean, Executive Director of the Institute of Mental Hygiene and the United Way for Southeast Louisiana's Public Policy Committee Chair. And I'd like to thank you for joining us this afternoon, which promises to be a very exciting, I guess an hour or so, where we'll hear awesome presentations from experts in their field. Why are we hosting these sessions? You know, every year in preparation for the state legislative session, United Way of Southeast Louisiana creates an agenda outlining our priority public policy issues in health, education, financial stability, and community strengthening. United Way's legislative agenda advances our fight to eradicate poverty in Southeast Louisiana through the Blueprint for Prosperity by supporting ALICE households. These are households that are asset limited, income constrained, yet employed. This is the second session of United Way's Public Policy Committee, and we're hosting these sessions to gain insight on key public policy issues from a variety of experts to help us create a comprehensive, informed legislative agenda. We'll also be collecting information on legislative priorities of United Way's community partners who provide critical on-the-ground services to vulnerable populations across Southeast Louisiana. We have a group of fantastic speakers for today's session. They include Dr. Dana Hunter, Executive Director of the Governor's Office, Children's Cabinet and Office of Human Trafficking Prevention, Connie Bellone, CEO, Health and Education Alliances of Louisiana, powerful Ashley Shelton, Executive Director of the Power Coalition for Equity and Justice, Andreanecia Morris, longtime housing expert, Executive Director of Housing NOLA, and my friend Judy Morse, President and CEO of the Urban League of Louisiana. Now it's my pleasure to introduce my really good friend, Michael Williamson, United Way of Southeast Louisiana's President and CEO, who will frame today's presentations by providing an overview of ALICE households in our region.
All right, well, thanks to my good friend, Ron McLean. Happy Friday to everybody. And it's a pleasure once again to be a part of one of our Public Policy Committee's education sessions. So, and a huge shout out to Mary Johns and the team behind the scenes that helped make all these things possible, and Charmaine for her leadership on advancing our public policy objectives that have been approved by the board. Thought we might take a minute, and Ron touched on it, talk a little bit about ALICE. For those who don't know ALICE, ALICE represents a part of our population that's asset limited, income constrained, yet employed. And these are hardworking, tax-paying individuals that earn low wages. And in fact, throughout Southeast Louisiana and the state overall, roughly 1 in 2 households are struggling day to day Many live above the poverty level, but they live slightly below what it actually takes to meet their basic needs. And like I mentioned before, they endure low wage jobs like cashiers, healthcare workers, security guard, laborers, and folks that are in office administration, but they play a vital role to our local economy and are very, very important to the long-term success of our region. They have no savings, so they can't save for an emergency like a Hurricane Ida when they're forced to evacuate and make tough choices about how to do that safely with their families. Nor can they actually save for their long-term needs such as retirement, homeownership, or education. And they're not unique to one particular community. They are in every parish throughout the state of Louisiana. So just a quick glimpse at what it takes to actually live in Southeast Louisiana. When I talk about a survival budget, here's a picture across a variety of categories. But as you can see, a single adult at a minimum in Southeast Louisiana would require $13.20 per hour just to meet their basic needs. So this doesn't include trips to Disney World and family vacations. This is the bare basics: transportation, childcare, food, healthcare, technology, which is so important today, and other miscellaneous needs. But at the end of the day, it takes more than what folks are currently earning right now. So how do we compare? At 51% pre-pandemic, Louisiana had the highest percentage of households with income below the ALICE threshold. And this is a prime example of how we continue to rank the top of the bad list and the bottom of the good list. And this is a driver for our discussions around our public policy work. And they cover all age groups. You can see here that ALICE spans all age groups, and the issues affecting ALICE do not play one over the other. And that covers all races and ethnicities, while we do see that Black households are disproportionately a high percentage of the ALICE families throughout our region and throughout our state. And they also vary by family type. And you can see here, prime example of that. And so the point to make here is that, and you've seen the past couple of slides, when we think about ALICE and whether you know ALICE or not, the harsh reality is you do know ALICE. It is a friend, a family member, a co-worker, or perhaps a stranger that you've seen on the street. But if 1 out of 2 households, ALICE is literally everywhere in our community. And then there's the pandemic divide. As you'll see here, before COVID-19 hit, 51 million US households already couldn't afford the basics. These households fared far worse during the pandemic than the higher income households, folks that could more appropriately weather that storm. And so what you can see here is about 42% of the 42% were below the ALICE threshold and struggling to get by, about 9%. 17% below the threshold quit a job due to childcare. They lost income, they had no rainy day funds, and they had elevated symptoms of anxiety and depression, which places massive strains on our mental and behavioral health care providers. And so to sum it up, and once again, ALICE is at the center of the work that we do at United Way of Southeast Louisiana, and at the center of any and all public policy agenda items and objectives we set for the organization. So you're in for a star-studded lineup of folks who know and understand these challenges, but also have solutions. So like you, I look forward to hearing from them today. Thanks, Ron.
Yeah, thanks. Thanks so much, Michael, for sharing this information on the plight of many of our hard-working families in our town. It's interesting that we continue to kind of pile up these dubious distinctions, like the one that Michael mentioned, of Louisiana being at the top of the list of those with families that don't quite meet the threshold for ALICE. And so we have a number of very hardworking, poor families that don't meet the criteria for public assistance, yet are one hard time away from being impoverished themselves. Can't afford the basics that many of us enjoy. And so this is our plight. This is the work that we have to do, because we sometimes share the plight of those families, and that's a strong commitment United Way has made. And thanks, Michael, for sharing. And certainly we can't forget about the pandemic divide that exacerbated conditions for many of these hardworking families that we're talking about. We're talking about the working poor and who oftentimes show up as essential workers. So Michael, thanks so much. Now I have the pleasure of introducing Dr. Dana Hunter. Dr. Dana Hunter was appointed by Louisiana Governor John Bell Edwards as the Executive Director of the Governor's Office of Children's Cabinet in 2017. In this role, she worked passionately to coordinate and align resources and policies for better outcomes for children in the state of Louisiana. In 2021, Governor John Bell Edwards appointed Dr. Hunter to serve as Executive Director of the newly established Governor's Office of Human Trafficking Prevention. The mission of this office is to prevent and combat human trafficking and to promote healing and justice for victims and survivors. Dr. Hunter.
Thank you, Ron, and thank you, Michael and Charmaine, for having me, and welcome again to all the other guests as well. It's such an honor just to be in this space and to have the opportunity to really look at policies, programs, and practices that impact families such as those that were just mentioned, the Alice families, because as we all know, so many of our families fall in this category. And one of the things we've been having conversations about and working on over the last several years is really looking at how can we take a step back and be more proactive and look at more services that are preventive and early intervention. And so we've been having those conversations, and the Children's Cabinet Advisory Board, the subcommittees have also really been looking at what are some of the really grassroots programs and programs that we can really move and roll out statewide to cause this impact. Again, early intervention and prevention is what we want to gain and what we want to look for. And so one of the programs that has been in our state, but it was piloted for a while through the Louisiana Department of Health, is a program that really looks at how do we assess families while children are yet born or in utero, and when children are first born, and how do we assess these families early on before children begin to experience that trauma. And so there's a perinatal infant and early childhood mental health program, again, that the Louisiana Department of Health has piloted for a while. And the Children's Cabinet Advisory Board, in their research, they thought it important to get statewide funding and statewide support for such a program. As we know, families go to the doctor. So moms have to go to the doctors for prenatal care. Once a child is born, they have those early checkups for children. Those are prime opportunities to see how families are doing, to assess what are the needs of this family. And again, we talk all the time about how we can't just treat or help children. We have to look holistically and be willing to serve and support the whole family. Because where do children go and where do children thrive? They thrive in their homes and in their family. So when the family is whole, the child can be whole. So we can no longer do this piecemeal approach where we're just looking to assist the child. We have to be willing to help that whole family. And this is one program that would do such. And so the Children's Cabinet Advisory Board recommended recommended to the Children's Cabinet to allow funding to support a program that would really assess any mental health services early on for families. Again, doctors and training doctors, nurses, medical staff, you name it, anyone who has touched or interfaces with these families early on. So very vital and important. And as we know, mental health, with everything that's been going on, mental health is becoming an increasing issue for many families, many children and families. We're seeing increased rates of suicide. We're seeing among children and adults, increasing rates of depression, increasing rates of homelessness, all of unemployment, all of these things. One, because of COVID, but also just the complexities of all of the issues compiled upon one. So early intervention again, and I know I'm preaching to the choir, but early intervention is key. And then really looking at our health systems, one of our subcommittees also recommended funding to invest in a comprehensive system for K through 12 mental health. So as you know, the day for paper records and all of that is long gone. We have got to provide funding for computer record systems to be utilized by both LDH and LDOE for better tracking and billing of mental health services for children in K through 12. Using funding to provide training on this system was also very important to our group. Training school personnel, district level personnel, and to provide funding for financial incentives for those who use this computer-based record system. Again, long gone are the days of paper records. It's not conducive for data sharing. It's not conducive for really having a holistic look at what the child's needs are in mental health. And then we know that there's been a spike in the number of children who are being raised by their families and specifically grandparents. And so really looking at what are supports that grandparents need to provide support and resources for their grandchildren that they are raising. There was a study done by the Lancet, reported a study that found worldwide 2 million children have lost a parent or caregiver due to COVID. And so if we can only imagine the now unanticipated and unexpected burden that grandparents are having to take on, I'm sure they welcome this burden because it's their grandchildren, but we know the stressors that come with that. And so providing supports to these parents are also very important. And then investing in 211 is also very vital when natural disasters happen, when incidences such as COVID happen unexpectedly, the pandemic. I'm sure you guys will never forget somewhere around March. We've done so much strategic planning in January. We had just gotten a federal grant, doing all of this planning and getting reports in on what we're going to do. And then all of a sudden in March, the state shut down. Yeah. And so we can only imagine in moments like that, how much we need services such as 211 to step in and to be a resource for our state so that folks can call in and know where the resources are within our state. And then really, as Michael mentioned before, so many families fall right there below the threshold or right at the threshold where they can no longer receive services or public benefits. So doing what we can to wrap our arms around these families and to look at policies that address this benefits cliff, as we call it, is also very important. And lastly, I'll just say, as director of the Children's Cabinet, as director of the Office of Human Trafficking Prevention, we know that when none of these services, policies, and programs are put in place, families, youth, and children are more vulnerable and have more opportunities to become victims of human trafficking. So we're working closely with the First Lady's office to look at policies, programs, and practices to train, educate, improve victim identification, improve data collection, and you name it, to prevent children from becoming victims of this heinous crime. So if you want more information of what we're doing at the Office of Human Trafficking Prevention, please visit humantrafficking.la.gov. Thank you all so very much again.
Thanks so much, Dr. Hunter. And as you spoke, I really thought a lot about the things you said, particularly around prevention and early intervention, which really speaks to starting as early as we can. And Dr. Hunter, your emphasis on this whole perinatal assessment piece makes every bit of sense, because the sooner we know what's going on, the sooner we can start responding to it with interventions. And certainly when Dr. Hunter talked about how you really can't help children without including family members, parents, and of course, grandparents, so that part of the work is with the entire family. And certainly, we can't leave out the need for assessing for mental health challenges, which unfortunately more and more people have experienced, and the pandemic exacerbated those challenges that families experience relative to mental health. And certainly, to respond to the mental health issues with families are really, really important, not only with the adults, but even infant mental health, which is really something that that speaks to bonding and speaks to the early intervention, when we know so much of brain development happens very, very early on. And so thanks so much, Dr. Hunter. And now it's my pleasure to introduce a long-term friend, Connie Bellone. Connie has 30 years of executive leadership experience in healthcare and nonprofit sectors. She designed the Coordinated Care for the Whole Child program, a unique program that cares for the whole child in a public school setting and identifies, prevents, and addresses the health and education disparities for students who live in poverty. Connie.
Well, hi, everyone. Thank you so much for this opportunity to highlight some of the important work that United Way is working on with us in the community. I work with an organization called HEAL, the Health and Education Alliance of Louisiana, and our mission is to eliminate poverty and help those ALICE families receive health care, especially the students who are in our public schools. Over 85% of our students in our public schools in Louisiana are below the poverty line or in ALICE families. It is very important that they receive, obviously, the mental health care that we have been talking about, but also the physical health care that is going by the wayside. You know, sometimes especially for our ALICE families, the only sets of eyes from a healthcare perspective that see these kids are the school nurse and the school mental health care provider, because mom is at work and can't take off a day to take them to the doctor, or doesn't have transportation, or dad is working 2 jobs or not in the picture. All of those things that affect our ALICE families are perpetuated in these kids in school. The changes in the preventative results that we have seen over the past 2 years is dramatic, because with children not being in the school setting, nobody is setting their eyes on these kids. So one of the things that we have been working on a lot is trying to come up with the funding stream so that we can continue to have these resources in the school setting, seeing these kids every day where they are. So Mary, next slide. Just as an overview, in this Medicaid in Schools is a program that draws down the federal dollars that pay for school-based health care. These are dollars that are at the federal level that are capped at 1% of the federal Medicaid budget. And if they don't come to Louisiana, they will go other places. We are the 4th worst state in accessing these dollars in the country. And this does not cost our state 1 additional penny. We use the state education dollars as the state match. So these are additional healthcare dollars, again, designed to pay the salaries and benefits for school nurses, school psychologists, school physical therapists, all that preventative and treatment healthcare providers in the school setting. Next slide. Mary, there you go. Just as an example, we average over the past 6 years, we're not talking about pennies here, we're talking about $246 million for the state of Louisiana over the past 6 years. But if you look at this snapshot in time, this is the last time that we have numbers from other states that have been collated. And even 6 years ago, Florida was at 120 million, drawing down when we were at 30 million. Texas was at 201 million. California was over 400, almost $500 million. And when you look at it on a per child basis, we actually have higher numbers of ALICE families and higher number of kids that are Medicaid eligible than any of these other states. Yet we're down at $30 million. So there's a lot of opportunity here. And I do believe that this program could fund a school nurse and a school mental health care provider in every school building if we're able to maximize this. Next slide. So this is our current list that I just These are actual dollars. These are federal dollars that we have received in this program that go directly to schools to pay for healthcare providers' salaries and benefits. $241 million has been accessed. And we are in the past 6 years, 2015 to 2020, we are still the fourth worst state in accessing these dollars. If you look at that pie chart at the bottom, that little green slice is the amount of money that we've been reimbursed for mental health care and behavioral health care. We have a long way to go to maximize that reimbursement. The blue is nursing. We're doing much better on that. And therapy has always done a really good job at it. We're still accessing the transportation piece. One of the biggest things that I wanted to talk about in one of our policy aims is improving the infrastructure that schools have to be able to draw down this money. I can tell you, we are in these schools every day. We're doing the work. We're just not getting the reimbursement because we have some gaps in the systems that schools have available to them to be able to document what they're doing. Mary, next slide. So let's talk really briefly about what it's school-based or Medicaid in schools is not. It is not school-based health centers. Those are additional health services in addition to. We're talking about the nurse that works for the school and the psychologists and social workers that work for the school. It is not private health care that comes in to provide services to special education kids, and it's not early intervention. There is early intervention that is covered, but these are services that are covered for students who work in the schools provided by employees of the school district. So all these other services are still available, and they're available in addition to these services. One doesn't replace the other, they augment each other. Next slide. Believe it or not, in the middle of this pandemic, back in March or April of 2020, we were able to expand this program to include all students. So many people were aware of school-based Medicaid because it covered healthcare services for special education students. Well, we're here to dispel that myth because now all Medicaid eligible students, so all of our ALICE kids, all of, 90% of our public school kids that are enrolled in Medicaid now qualify for health service coverage. So what that means is the services that they receive in the school setting are in addition to the services that they receive privately through Medicaid. The services that schools provide do not count against their personal healthcare benefit. They are in addition to. Next slide, Mary. I think I covered all of this part. Next slide. So here are our opportunities, and this is where our public policy opportunities lie, in my opinion. We need that unified electronic health record that Dr. Hunter talked about, not just for mental health care, but for all health care. We need a system that is owned by the state where our student data stays within our state, and we have one way to document all of the services that schools provide that's easy to use and accessible. That's one of the biggest barriers to receiving the reimbursement. I said it once, let me say it again. We're already doing the majority of this work. This will cover additional work. It'll cover additional mental health care services. It'll cover additional nursing support with COVID and with diabetics and sickle cells and trauma and all those other things. But we have to be able to document the services we provide in order to be reimbursed for them. And that is our biggest hang up right now. That's our biggest barrier to receiving this increased reimbursement. It's a complicated formula because it's not fee for service. Like if you provide a service, you get reimbursed. It's a percentage of salaries and benefits. So without getting into the weeds, let me just say that the percent of direct care that is in that formula is a statewide number. So right now, school districts around the state are responsible on their own for coming up with their own system. Some of them have pieces of paper in a file cabinet. Some of them have standalones on desktops. Some of them are using checklists that don't meet HIPAA and FERPA requirements. But the bottom line is they will be audited, and without increasing that percent of direct care by proving that they've done these services, we won't be able to increase and access that additional reimbursement. So now with all of these federal dollars here to help us develop systems, it's the perfect opportunity for use of one-time dollars to be able to access these recurring dollars. These Medicaid dollars are available every single year for the services we provide. They're not one-time dollars. Next slide. So the coordinated care for the whole child program improves health and academic outcomes for our children in poverty and our ALICE families. That is the program that we administer here at the Health and Education Alliance of Louisiana. I just wanted to say that we're focusing on the Medicaid and the documentation system because as we administer this program throughout the state, what we realize is that we're already doing so much of this work. We have amazing school nurses, amazing school psychologists, amazing social workers, but we don't have systems that support them practicing their professions. There's a lot of work out there right now. I was just at a high school with 2,000 students in Orleans Parish, and that school nurse is trying to collate a report of all of the students that have COVID vaccines that they've received. The report that she has access to will take about 2.5 weeks to do a count. That's a count. That's a clerical task that we can use a computer system to do in less than 5 minutes. And I have someone right now working on that report to fix that for her. But those are the type of things that get in the way. We have psychologists, we have social workers. We don't have enough of them, but we do have many of them that are doing things like lunch line and counting attendance and other clerical type activities that we need to streamline and provide a systems approach so that they can practice their profession and provide that trauma-informed care and that very necessary mental health care that we all talk about. Mary, next slide, please. This again is a breakdown of the other $241 million that we've drawn down. And as you can see, the 4% in that gray bar is the mental health care. But if you look at the behavioral health is the second row of bars, you can see that in that green bar, we have increased our documentation up to 8%. So we are making progress, but without a statewide unified electronic health record, it's going to be very difficult to continue to push that forward. Mary, next slide. Again, it all adds up. Healthier kids learn better. Right now, we have so many kids that are failing screenings that we had turned the tables on. When we started doing this work about 15 years ago, we had vision failure rates in over 40% of our students in schools. 40% of our fourth graders could not see the board. Let me say that again, 40%. Imagine what they could demonstrate if they could see the dots on their Scantron form. So we're evaluated on standardized test scores, and kids don't have the skill to see the form on the paper. And without the electronic health record or a healthcare plan in place, they don't receive the accommodation of getting the enlarged dots to fill in. I mean, they're very simple, systematic challenges that schools are facing across the state that are getting in the way of demonstrating what our kids know. I will tell you that we continue to do probably about 4,000 to 6,000 vision and hearing and preventative health screenings every year in schools. And then since COVID hit on March 13th of 2020, we've seen vision failure rates increase from 17% back up to about 35%. We're going backwards because kids are on screens all day long, whether it's a phone screen, whether it's a computer screen. Now they don't have the eye-hand coordination of having a textbook. They have to scroll when they read their books on the screen. So there's no memory, visual memory of where they read that in their book. And, the hand-to-eye coordination of flipping the pages, all of that are important factors in learning that we're not paying attention to. There are lots of studies out there from Harvard and Yale and people way smarter than me that have demonstrated that paper textbooks have higher standardized test scores than schools that use electronic textbooks because of that loss of visual learning and hand-eye coordination and perceptual learning and all of those things that they studied. So it just makes sense. Kids have to be able to see, they have to be able to hear, they need the interaction. The social emotional health of these kids, suicide is up dramatically, depression is up dramatically. These kids are not interacting with each other. And this cohort now, getting ready to go to college, have missed 2.5 years of social interaction. And we're getting ready to put them in dorms without their families, the ones that are lucky enough to be able to go to college. And the other ones are going into the workforce without the social skills of how to communicate. You know, they can't read each other's nonverbal communication because they haven't seen the faces of their classmates. We did a survey of second graders, and of the second graders we surveyed, greater than 95% of them had not even seen the full face of their classmates. Think about that. How much communication goes into nonverbal cues and reading the way people respond to what you say and the tone of your voice. And if they can't even see their face because of a face mask, for 2.5 years, they're going into 3rd grade, but we want them to be on par, and we're going to judge them by standardized tests that they now can't see the dots to fill in.
And that is some really, really helpful information, Connie, as you shared about children. I'm not sure how much more you have, but
I think that's about it. Mary, you can flip the slide. I think that's it. You can flip that again. That's just about heal. And there's my contact information. Again, these kids need our help, and we need health and education systems to be up to date and streamlined so schools can do the work that they're working so hard on.
Connie, thanks so much for sharing this very helpful information about how we can help the children of Alice families access healthcare in schools and beyond. As Connie mentioned, school nurses and healthcare providers play a critical role, and that sometimes they're the only real eyes on children, and they're in a position to be able to help them access services. And so we need to sort of do what we can to empower and resource the school health providers so that they can continue to do their job. As Connie mentioned, there's opportunities, significant opportunities to access federal dollars. It's almost like some people call found money. There's always, the young people are eligible for it based on their Medicaid status, but we just we haven't done a good enough job at accessing it. Although HEAL has really helped access some 241 million over a number of years, we're still way behind as a state. And certainly one of the recommendations is improving schools infrastructure, particularly electronic health records and other efforts that will streamline the process of accessing these federal funds. So thanks so much, Connie, for sharing this very helpful information. Now it's my pleasure to introduce somebody who's been very, very busy lately, who continues to shine and do great work, Ashley Shelton. Ashley Shelton is the founder, president, and CEO of the Power Coalition, a statewide 501c3 table in Louisiana. The Power Coalition uses a broad-based strategy that combines community organizing, issue advocacy, and civic action, all while increasing the capacity of community organizations throughout the state to sustain and hold the work. Ashley.
That's a fancy way of saying that we're just out here fighting for everything. You've heard me speak. I always say everything I love is in this place, and so I'm going to fight for it. But thank you so much for having me on the panel today. This is such an honor. So many great friends on this panel, and some Power Coalition table members and partners on several things, and so I'm honored to be here. I'm still reeling from Connie's presentation from the perspective that, it reminded me that there are these gaps in so many ways for our Alice families and how easy it is to address them. And it reminds me of the work that Danny Mintz did at the Budget Project around, ensuring that school districts applied for this federal, support for all free and reduced lunch for kids, in parishes throughout the state of Louisiana. And so it's these kinds of gaps that, that we're just leaving money on the table when you can't do that, when we are such a poor state. And, to so many of the data points within the Alice report, we find time and time again that we've just got to connect these dots and make sure that at a minimum that we take care of our children, but that we also begin the process of healing our state and its people. One of the things I talk about all the time is, Power Coalition, most of our work is, around civic and voter engagement. One of the things that's really, interesting about that is that I think more than ever, voting has become a social determinant of health. I think that people feel, apathy around the fact that, the political process is nasty and it doesn't feel good. It doesn't feel like that there's, I always tease, and I even testified this week about, I said, it's funny that when I'm in community, I never feel so far. I don't feel that far apart from the people that I'm with. I don't feel like there's so much that we disagree on that we cannot appreciate and care about each other. I said, but when I get to the Capitol, it seems to be a huge chasm between what the people feel, their values and the things that they care about, and then what our legislators are actually willing to fight for. And with that, a couple of those things include raising the minimum wage in our state. And so this legislative session, the Power Coalition will be fighting for increased wages for the families in our state. We know that 82% of the state of Louisiana, in multiple surveys done by both conservative and progressive folks, including the Power Coalition, we did our own survey, on this particular issue. We know 82% of the people in the state want to raise the minimum wage, and then another almost 60% want to raise it to $15. And so with those numbers, if you've ever done policy work, you know that you can win, right? You should be able to win anyway. And the reality is that we don't have the political will in this state to do what's right for the people and our families. And that's, as we talk about things like community strengthening, there's so many opportunities to have your voice engaged in this process, to be able to speak to your local elected officials as well as your state elected officials. They are here to serve, even though it doesn't always feel that way, but they are. And that we think that that's a key strategy to actually realizing change, in addition to raising the minimum wage, which we've actually brought to the Capitol for at least the last 6 years that we've been doing it. That I've been around, but I feel like it's a fight that we've been fighting for a really long time. But also paid sick leave. I mean, we're coming off of multiple traumas in our state, whether it be Hurricane Ida or this never-ending pandemic. And the reality is that, here we are with the pandemic that, that all the targets of how you keep your family safe and what safe actually is, how it's defined, we're seeing that that's actually being defined by our elected leaders. They're deciding whether you're safe at your job. They're deciding whether your kids are safe at school. They're deciding if you have access to healthcare. I mean, all of these things that we've been talking about today, all of it comes down to how are we ensuring not only our elected leaders, but that our systems actually work so that we can move people in places out of poverty and the challenges of poverty, and then what ultimately becomes criminalization for many people in our state. On paid sick leave, we will be bringing that to the Capitol again this year because, again, how can you take care of your family? And we're seeing as the policies and rules change around COVID that you no longer have the cover of being supported if you contract COVID. And for many people, this is really, we're not only a poor state, but we are also a sick state. And when you have a lot of, folks that are reeling from different health issues, like the idea that you are impacted by COVID and then you're trying to keep loved ones safe. And there's a lot of intergenerational support and care within our community. It's a cultural thing within our state and our communities that, the idea that you can't keep them safe because you've got to go to work and you will not be given, that you will have to take those days without pay. And that's a real issue. And the fact that, we've not been able to really have great movement on this is unfortunate, but we're going to fight like hell given the data that we're seeing coming out on the other side of COVID. We're also fighting around modernizing the emergency planning process. On the other side of Hurricane Ida, one thing that we know, it hit on the anniversary of Katrina, but what's also unique is that usually hurricanes always hit at the beginning of the month, the end of, like the end of the month, or the middle of the month. And it's unfortunate that it happens that way. But what it does effectively is really push families into a debt cycle that is hard to recover from. And we've got to figure out how to get more of those dollars to the ground and how to prioritize making sure that our families are okay. I mean, I'm proud to say that we You know, we did over $300,000 worth of direct cash assistance. And even though we are many months away from Hurricane Ida, we are still providing cash assistance and support to families across the state of Louisiana that were impacted by the storm, because the devastation and the disconnect between our emergency preparedness system and our communities, you know, we have to continue to bridge that. And we're also doing some work to also make sure that FEMA is more accountable at the community level. And then I don't want to, you know, I'll wrap with this around ARPA dollars. There are billions of dollars that are within our state right now. And this is American Rescue Plan money that was here to actually say, you know, help us rebuild our communities after the impacts of COVID. You know, that first tranche of funds are really focused on supporting and investing in our businesses and trying to get our businesses back healthy. And I think that we also need to start to think about, like, now it's time to focus on our people. I think that as we see violence explode across our communities in the state, that, you know, if we don't address and acknowledge that, you know, exacerbated poverty and hopelessness have been triggering this violence, and then its future impacts on our children that will be teenagers and young adults, much like we found after Hurricane Katrina, you know, like, there is trauma in this, and that we need to really be able to move some of those ARPA dollars to the ground. And again, I'll reference our good friends at the Budget Project. You know, like, they've been talking about, like, how important it is to drive these dollars to the ground. And we're working with many of the partners on the phone today to, like, make sure that, you know, they can actually use ARPA funds to see state paid a funding for a state paid leave program, housing and security and shelter fund. They could do a reemployment and retraining fund, IT revolving fund for state justice systems, Water Data Act. I mean, constitutional requirements around the rainy day fund. Like, there's so many ways that our state can engage. And what it's going to require is that, you know, community gets engaged, and Power Coalition's here to support you in that. You can go to powercoalition.org, and we are always happy to connect and support the ways in which you want to civically engage in your community. As my good friend stated, you know, Ron said, you know, we've been fighting at the Capitol around redistricting. It is unfortunate that a third of our state is African American. Almost more than 40% of the total state population are communities of color, and our redistricting process has refused to acknowledge that, both at every level of government. And so we need your voices. We need to ask that the governor demand that the governor vetoes these maps, so that we can at least begin and have a conversation about what does representation look like. And I'll tell you why representation matters. Our current congressional House delegation are on some of the most powerful committees in the United States Congress. And unfortunately, though, we don't see that coming back to our communities and coming back to the ground. And in addition to that, as we see these state the infrastructure dollars that was just passed by Congress, and those dollars descending upon our state, the majority of our delegation voted against that. And so again, community strengthening is about engaging, fighting for your voice, and vote and power. And Power Coalition's here to support you with that, as well as my friends on the phone today. And so, on Zoom today. And so we're grateful for the leadership of all of our partners, and just encourage folks to get engaged.
Ashley, thanks so much for this helpful information. It really makes sense. And we've seen you fight, and the Power Coalition, as you mentioned, fighting for everything, including obviously increasing the minimum wage, paid sick leave, which has special significance in the context of the COVID pandemic, and certainly fighting for to get more people registered to vote is so important. When you think about something Ashley said that really resonates with me about this disconnect, if you will, between the elected leaders and the will of the people. When you think about some of the surveys that mention what people will support, and then you have elected officials who kind of like not maybe ignoring those reports, but anyway, making decisions that may not be reflective of what the prevailing opinion of the people, which has implications for another thing that Ashley talked about, is civic engagement. And we got to get more people interfacing with these elected officials, and the Power Coalition has done an awesome job at doing that. When you think about something, 80% of the people in the state want increased wages, and then that just continues to come up, so with no sort of very little support from the majority of our elected officials. So we have work to do. And thanks, Ashley, so much for sharing this helpful information. And we'll certainly stay tuned. One last thing, this whole use of these dollars, these American Rescue Plan Act dollars, certainly we can do a much better job at doing that. And using that and having more people civically engaged might get a better result there. And so we have two other speakers, and I won't go too long here, but I want to introduce at this point Andreanecia Morse. Andreanecia Morse serves as the Executive Director of Housing NOLA, a 10-year partnership between community leaders and dozens of public, private, and nonprofit organizations working to solve New Orleans' affordable housing crisis. Prior to her role as Executive Director, Ms. Morse spearheaded the development of Housing NOLA's 10-year strategy and implementation plan. Andreanecia.
Good afternoon, everybody. Thank y'all for having me here today. Can y'all hear me okay?
Yes.
Great. I have a presentation just to kind of ground everybody in the numbers when we talk about what it means when we say to end housing insecurity and to address the city's affordable housing crisis. So we want to just set a little context. Everybody knows about Katrina and how it devastated our housing market. It made the city uninhabitable for so many people. It also created an amazing investment opportunities. $9 billion in the Road Home program, hundreds of millions of dollars to help first-time homeowners and new developments coming online. We doubled the amount of housing choice vouchers, going from 8,000 to 18,000 in 10 years, and $500 million creating thousands of new units just in New Orleans. But unfortunately, as we approach the 10-year mark, while we had made these amazing investments, we had not addressed the racial biases that made this system inherently unstable to begin with. In 2014, the median income was $37,147. Median rent was $900. Average home value was $192,000. And a lot of people erroneously thought these numbers were to be happy about because our real estate market was exploding. But the fact that median income was not keeping pace, actually that $37,000 is, when you adjust for inflation, is actually lower than it was 30 years prior. So this ties into the ALICE results, the reports in ALICE is showing folks not being able to take advantage of opportunities. And the average home value is particularly troubling. Again, some people may think this is cause for celebration, but when you talk about generational wealth, in order for generational wealth to work, wealth building to work, the house must be able to be passed on in good condition to the next family. If you buy your home and you raise your children there, and that's great and amazing, but if you die and that home is in poor condition, or your children cannot pay the property taxes, you've taken out a reverse mortgage and they can't settle that debt, that is not generational wealth. And this is the kind of thing that happens when you see such a dramatic shift. Before Katrina, 60% of all homes in New Orleans were valued at $100,000 or less. And then seeing the average home value go 9 years later, almost doubling, is cause for concern. And now we look back on the state of housing in 2020, seeing these numbers continue. Again, median income not increasing, median rent increasing in 6 years, 10%. Average home values continue to ratcheting up while wages are not matching pace. And one of the other reasons that this is a problem, because even when you look at median income, $38,000, this is for a family of four. That's not a lot of money, but that's the median income for the people in the city of New Orleans. So half the people who live in New Orleans make less than that. That's the median point. And so this is important to keep in mind when you look at this, a family like this and making $38,000, and their 30% of their gross income should go towards their housing costs. What they can afford, including their utilities, is about $960 a month. That's not a great number to begin with, because that leaves them with $1,800 left for food, childcare, transportation, things that are much more expensive. So even if they are not cost burden, even if they're paying the magic number of 30%, there's still little left to move forward. And this is the kind of thing that the Alice report has been so amazing at drilling down on, explaining to people how folks who are struggling, contextualizing the struggle. What we focus on is the housing piece, because it is the biggest expense that any family or any household can have. It is the foundational piece, to be corny. And it's the piece that we have the most trouble with. It's the piece that we have the most issues with dealing. When you talk about, we hear people say all the time, the rent is too damn high. What does that actually mean, right? So MIT tells us that that same family should be making about $26 an hour. That's what they should be bringing in to live in New Orleans. The rental wage in New Orleans, in order to afford a 2-bedroom house, is about $20.40. Poverty wage is $12.38. So again, everyone thinking our Uber and Lyft drivers and the Instacart drivers are making big bucks because they are making $12 an hour. That's the poverty wage in New Orleans. Thankfully, though, we've seen some progress. The city of New Orleans set their living wage at $15 an hour, but that's still well off the living wage for a family of 4 to afford a 2-bedroom apartment. And it's still off what you need to rent comfortably at 30%, right? That's at the 30%, still leaving you with some serious choices that you need to be making. What are the causes of this? There's a number of them, but it all boils down to systemic bias. We still are incredibly comfortable in this country with the anti-poverty, anti-woman, anti-Black bias that is knotted up with housing, with the terms affordable housing. And it's something that cuts across all ideological spectrums and all economic spectrums, and unfortunately all racial spectrums. In New Orleans, being a majority African-American city, one would hope that we would have our arms around this a little bit better, but we don't. We are still missing out on that, and we can prove that when the city of New Orleans voted by 1,000 votes to end contributing the smallest amount possible to our neighborhood housing improvement fund, to our housing trust fund, while overwhelmingly deciding that we wanted a reform candidate for our sheriff. And I just kind of look at folks and say, so what's the sheriff going to do if the new sheriff starts releasing people? Where are they going to go? We just ended the housing trust fund. These values don't compute. And it is not because people are superficially engaged around the rights of the formerly incarcerated. It is because they have not drilled down around their bias around housing. So that's what we come in. We work on increasing affordable housing, reversing displacement, ending systemic inequity, building resilient communities, making sure we have housing for all through strategic strategies so that we can improve quality of life. We issue an annual report card, and I want to dig in a little bit about some of the snapshot numbers while we talk about this, showing what's happening because of COVID, right? People missing their housing payments across the state of Louisiana, how COVID has contributed to this and made a bad situation that much worse, and how we need to make sure that our rental assistance, and I've been so proud of the South of United Way of Southeast Louisiana. You guys are one of the first ones out of the gate to do home ownership assistance in 2020, right, Michael? The state of Louisiana didn't launch its home ownership assistance program until a couple of weeks ago. So you guys recognize that this was necessary and needed. And we look at these numbers, how things have gotten worse over time, over the last few years, cost burden continuing to be at an unacceptable level, not just for renters, but also for homeowners. And one of the things that we also need to pay attention to the fact is that our failure to address this issue is hindering our growth. And so to Ashley's point, we need to make sure that we are investing the American Rescue Plan funds and any other funds that we have towards addressing affordable housing and making sure that people have safe, decent housing. And I've got my 2 minutes warning here. I wanted to, wait, I'm gonna skip towards the end. One of the things that we've been talking about over the years is how much money is necessary. We estimated 4 years ago that in order to address our 2015 goals, we needed about $6 billion. Unfortunately, because of COVID and Hurricane Ida, those numbers are not the right numbers anymore. So we need significantly more money to invest in New Orleans to address these issues. And it doesn't have to be, I mean, we also have to have this conversation, frankly, about these kinds of investments. We use the term investment very deliberately. So while yes, this does need to be anchored with hundreds of millions, likely billions of dollars of grant funds, particularly for the most vulnerable, there's also investment opportunities for property owners to get capital to make investments to truly get generational wealth, right? I'm not talking about grandma getting a mortgage against her house so that it can be decent. I'm talking about you've inherited your grandmother's property and you can't actually access resources to rehab it, to rent it, to keep it as generational wealth. We can and should be providing those resources to those families, to Native New Orleanians, so that they can rent to their neighbors, to their friends. Right now, we have another one of those situations that just demonstrates how deeply rooted the bias is. There's a couple hundred voucher holders, Section 8 voucher holders, who can't find landlords right now to rent to them while they can guarantee rent. This is why we are having a 20% vacancy rate in the city of New Orleans. This is why we are still down 100,000, mostly African Americans from pre-Katrina, and over 220,000 people from our maximum population in the 1960s. So that is, I'm going to conclude there because I can keep going on, but I got my 2-minute warning a little bit ago.
Well, thanks.
But thank you all so much.
Thanks so much, Andreanecia. Powerful presentation about housing and how fundamentally important that is to all families, but particularly to Alice families. Certainly, as you mentioned, the housing is such a fundamental, foundational piece. Biggest expense for families, but one that has the most issues, as you've indicated, and certainly the COVID and the pandemic has made this a bad situation worse. As Ms. Morse pointed out, sometimes when we've made some movements to address the problem, we hadn't looked at the core causes, the basic issues, and that, and a lot of times, is systemic biases. And this may have played out in the recent vote that really didn't support keeping the housing trust fund going. And certainly that will have some implications for our Alice households that we need to kind of pay attention to. And the trends now are also challenging as we look at a situation where housing costs for both homeowners and renters are going up significantly. Post Katrina, it's almost doubled, but the wages are not keeping up. And so we have this critical situation that certainly Andreanecia has responded to for many, many years, but it needs for more of us to pay attention to, and certainly the policymakers to make good use of ARPA and other dollars so that we can support affordable housing for vulnerable families. Thanks so much. Thanks so much, Andreanecia. And now it's my pleasure to introduce Judy Morse. Judy Reese Morse is President and CEO of Urban League of Louisiana. She is formerly Deputy Mayor of the City of New Orleans and brings to the Urban League of Louisiana vast executive level experience in government, not-for-profit, and media sectors. She has served at all 3 levels of government, including on Capitol Hill for Congresswoman Lindy Boggs, and in Louisiana, Lieutenant Governor's office. Judy.
Hi, good afternoon, everyone. I am really, really thrilled to be a part of this conversation representing the Urban League of Louisiana. So many friends on this panel and so much respect for the work that is being done. The Urban League of Louisiana, for those of you who are not familiar, is a civil rights organization that's been in Louisiana since 1938. Up until 2016, the work was focused on the greater New Orleans area, but in 2016, following the Great Flood, the Urban League of Louisiana expanded its footprint to begin doing work in Baton Rouge. Once we made that move, we decided that we really should expand our efforts across the entire state. So the Urban League of Greater New Orleans became the Urban League of Louisiana, and our focus is to look at work on programming, on policy and advocacy across the state of Louisiana. Today's focus really is about the upcoming legislative session and what we are going to be looking out for. But before I start to talk about some of those areas, I want you to know that we have at the Urban League what we call our annual policy cycle. And we try to make sure that we keep ourselves focused and as strategic as possible in the work that we do in order to amplify the voices of the communities that we serve, and also to really deliver for them the resources, the policies, and the action that it takes for each of them to strengthen themselves individually, their families, and their communities. We do not purport to be the experts at the Urban League of Louisiana. We hope that we perform expertly as possible in delivering on what community wants and what it is that they desire for today and for the future. And that also includes eradicating problems and issues of the past. So our policy cycle includes a statewide listen and learn tour. We have targeted 7 cities in Louisiana, and we visit those cities on an annual basis to engage communities so that we really understand what it is that the community is interested in and what the community wants. We do this in partnership with the Louisiana Legislative Black Caucus. We did our first tour in 2019. We started a relationship and partnership with the Black Caucus in 2019. And so together, we traveled to New Orleans, Baton Rouge, Shreveport, Monroe, Alexandria, Lake Charles, and Lafayette to hear, again, what is happening in those communities and to hear what it is that people would like to see happen in their communities. And that is what we then try to focus our efforts on. We take what we learned from the Listen and Learn tour, and we use that to inform the work that we do for our statewide empowerment and policy conference. That conference is right around the corner. It's March 16th and 17th this year. It will be virtual because of the pandemic, although we will be live streaming a couple of sessions on the 17th from Baton Rouge. This is a critical part of what we pay attention to and what we're on the lookout for. We look to bring national, state, and local leaders from the entire state of Louisiana together so that we can get information to act on. This is not a conversation for conversation's sake. It's not a conference for conference sake. It is really designed to bring individuals together so that they can share their expertise, both traditional and lived experience expertise, so that we understand what it is that we need to do as the Urban League and what we hope we can inspire others to do as well. And so the Listen and Learn tour informs the content for the policy conference. The evaluations that we get from the policy conference then feed into policy work groups. These are smaller tables that we put together in those same cities so that we can bring people together to have a more intimate and more focused and more strategic conversation about what it's going to take in order to bring about the change that our communities want to see. We take what we learn from those discussions and build it into what is the Urban League of Louisiana's legislative policy agenda for the year. We also are going to be on the lookout across a number of areas for bills that we either want to support or oppose. And then we invite all of those that we have engaged throughout the year and the larger body of supporters of the Urban League of Louisiana to advocate. We enjoy and have great pleasure in working with our partners like the Power Coalition and many others around the issues that we share a focus on. And we also know that working together just strengthens and amplifies the voices of the individuals that we are all serving in our own unique ways. So with that policy cycle in play, here are some of the areas that we are going to be paying attention to this legislative session, as well as some of the areas that we deliver programming in as well. So education equity, really important. We're going to be paying attention to what is being said about education this legislative session. We have an education equity report that the Urban League produces. We've done 2 reports for New Orleans in the last 5 years or so. We've done 1 in Baton Rouge. And at our policy conference in March, we're going to be issuing another education equity report that is COVID focused and that will be looking at issues that have been impacted in education across the state. It is our plan to do a report for Lafayette this year, and then we will cover those other cities that I've mentioned next year and in years following. We want to be able to focus on what the gaps are between white students and students of color, and work in partnership with school districts, in partnership with school advocates, nonprofit organizations, parents, families, the business community, anyone and everyone who says that they are interested in education. We want to work with them in order to focus on what it takes to close the gaps that exist, because we know that when that happens, all students will actually have the opportunity that they deserve to have an outstanding and spectacular learning experience in education. Health equity is also going to be another issue that we're paying attention to this legislative session. We learned from our Listen and Learn tour in 2019 that mental health is a huge, huge issue for the individuals that we serve. And so we focused on it at our conference in 2019. We didn't have a policy conference in 2020 for obvious reasons, but we did have one last year, and mental health still ranks high. We serve job seekers, we serve existing and aspiring entrepreneurs, we serve parents through our programming here at the Urban League of Louisiana. And so we hear firsthand every day what the issues are and what the challenges are, and many of them are related to health and wellness. And so we are going to be expanding our footprint in this area this year, and we're going to be looking to see what is coming out of the legislature. And of course, based on what we know is important to our stakeholders, we will be supporting or opposing legislation in that space. I mentioned education equity, the wealth gap. This is a really critical area. Some of the other speakers have touched on this. The Urban League of Louisiana is leading an effort called Sea Change. This is a collective and using a collective impact approach to focus on what it will take to close the racial wealth gap. This effort is focused on the greater New Orleans area. We are finishing up an 18-month planning period that has included many of the individuals participating in this conversation today and beyond, because we know that there is a gap. This is the #1 issue that we've heard during our Listen and Learn tours for the last 2 tours. This is the area. And so this effort is working with a number of organizations, and that list will be growing as we work towards building a framework in order to actually close the gap. So it will be very specific. It will be multi-year, and it should be something that everyone is in support of, because the data is obvious. When we close the racial wealth gap, everyone does better. And so part of this effort is going to also focus on a narrative and public education and awareness effort so that we can get out of this zero-sum argument. We're not looking to take $1 away from someone and give it to someone else. We actually need to close the gaps, and there's some very effective strategies that we will be sharing in this regard later this summer. that will allow us to do that in a way so that we can close the gap and then create opportunities for everyone, and also be able to access the billions of dollars that we leave on the table every year from an economic development standpoint because of these existing gaps. And so we'll be looking at 3 areas in particular this legislative session. Wages and income, which is one of the levers that we have studied and are focused on. Home ownership, you just heard the brilliant presentation by Andreanecia. That is a primary area. And business ownership. Based on data, these are the 3 areas that, if focused on, will allow the racial wealth gap in the greater New Orleans area to close as soon as possible. And we're going to be outlining how many years it will take, what those strategies are, who the partners we hope will be in this effort. And of course, a big part of that is going to be, I believe, policy changes. And then I'll also say that criminal justice reform is and always will be a top issue for the Urban League of Louisiana. We will be paying attention to the bills that are likely going to surface this legislative session. Many of you know that the Urban League of Louisiana has, I think, played an important role in the Justice for Ronald Green case. That matter is critical to, I think, the safety of everyone in the state of Louisiana. And safety, I think, can be defined in a number of ways. We cannot expect to be a great state when our people do not feel safe and when there are inequities in policing. And so a number of reforms are going to be discussed. We'll be paying attention to all of them and supporting the ones that will advance police reform while we continue to be very direct and very clear about what we believe must happen at the level of the Louisiana State Police in order to deliver justice for Mr. Green's family and representative of the justice that so many other families have not received. And so that is what we're going to be focused on and looking at. I've mentioned just a couple of the initiatives and the programs. We have a Wake Up, Go Vote, voter education and mobilization effort that we focus on, and that is year-round, getting people to pay attention to the issues that are important to them, and then actually exercising their vote. And so I think I'm at time. I'm pretty certain that I am at time. And if I'm not, then I'll give back some time. But thank you again for the opportunity.
Thanks so much, Ashley. Ashley, God, Judy, help me out.
You can call me Ashley.
She'll get me for that later.
You can call me Ashley Shelton any day of the week. I will answer.
Thanks so much for sharing this information, particularly this annual policy cycle makes every bit of sense in terms of getting, going on tours, getting information that's actionable and actually doing something about it. And certainly Judy talked about these 3: education, health, and wealth equity. And, realizing that there are significant gaps and we should be able to be doing something about them. Gaps between white students and students of color in schools. Is there something that we can do about it? And certainly there is, but we have to pay attention to it and we have to lift it up. And certainly the work that Ashley and the Urban League, Judy and the Urban League are doing has lifted up these issues and continue to do it. She also talked about mental health. Every speaker talked about mental health, and it's a real challenge for our Alice families and for our entire community. And these mental health challenges, of course, were exacerbated by the COVID pandemic. And also thanks for sharing the big 3 that you talked about, Judy, wages and income, home ownership, and business ownership. These are the ways that we can work to close this racial wealth gap. And certainly we have to work on getting more and more people to vote. So thanks so much, Judy, for sharing this awesome information. We look forward to more work to come and joining you and all of the speakers in our work during the legislative session. Thanks, Mary.
Yes, all right. Thank you so much, everyone. Those were fabulous presentations. We're going to open it up now for questions. I have two that we've received already that I will start with, but everyone else, please feel free to drop your questions in the chat or in the Q&A section for any of our speakers. So Connie, we will start with you first. This one came in during your presentation. Are you also testing, I'm probably going to say this wrong, for Erlen syndrome?
Erlen syndrome is a visual processing disorder where your eyes can see, but your brain cannot. And so just for those who don't know what it is, and unfortunately, we are not testing for Erlen syndrome. We should be testing for Erlen syndrome. It is not universally recognized as by Medicaid as of yet, but we are working hard on that. Screening for Erlen's takes place across Europe on every child. In Orange Beach, California, in all of Texas, most of Florida, it is a recognized visual disturbance problem. I'm very, very familiar with it because my daughter has it. So I had to travel to Texas to have her diagnosed, and I have to travel to Texas every 6 months for her to be treated. So unfortunately, no, is the answer to the question. It is something that we do have the ability to train teachers to screen for, but it is not yet common practice in the state of Louisiana.
Great, thank you so much. Okay, we have another question for Judy from Patty Riddle-Barker. Please recap the 3 factors driving the wealth gap.
Yes, thank you. And hi, Patty. Thank you for the question. So again, this is our work around the Sea Change Collective, a collective of organizations that have been working for the last 18 months to put together a long-term strategic framework to close the racial wealth gap here in the greater New Orleans area. We did our homework. Our partner in this effort is the data center. And what we learned is that there are 3 areas that will help to close the racial wealth gap between whites and African Americans, Hispanics, and Latinos. And those 3 areas are wages and income, home ownership, and business ownership. And so we have been doing research around those 3 areas. We've been talking to experts nationally as well as across the state, but obviously with a focus on the greater New Orleans area to make sure that we have the quantitative data that we need. We also have been engaging community members to make sure that we have the qualitative data that we need. And we've got some of that represented on the steering committee that has been working together collectively and steering this work. The data points are all on our website. We've got not only the data points that the data center compiled for us, but we did a national landscape scan. So we've got a lot of information that really makes the case for focusing on these 3 areas versus other areas. We know that there are many other areas that contribute to the gap, but when we look at the population, when we look at the greater New Orleans area, those are the 3 that will really make the difference. And again, you heard Andreanecia talk about the importance of home ownership in building wealth. We know that that is a key way for individuals to be able to pass wealth on from generation to generation. So that is an area that is critical. What are the policies? What are the programs that need to be in place, that need to be well resourced? What kind of technical assistance do potential home buyers and existing home buyers need in order to make sure that that asset is something that can be as full and robust as possible and is certain to be passed on. Business ownership, we know, is critical, particularly for business owners of color. And so again, access to capital, technical assistance, back office support that we have learned during the pandemic. Many of our businesses of color are not where they should be, and there are many reasons why. And so what are the kinds of supports that are going to be needed to be able to make sure that those businesses are not just good for one generation, but that they are strong enough and thriving enough so that they can be passed on for future generations. And we've had the conversation about wages, again, critical. So we're going to be looking to really outline and spell that out. A lot of great work has been done already. So we want to amplify the need for that, and also show the interconnectedness. For us at the Urban League, a lot of those areas are connected. And so we're going to be making the case and kind of showing how all of these things fit together and can come together if we have an integrated approach that is supported by many. If we can all come together and agree that this is important, and that's why we chose the collective impact strategy, then I think there's a lot of work that can be done. And I think we can actually close the gap.
Judy, thanks so much for that wonderful answer to Patty's question. I think there was one or two more.
Yes, yes.
Right.
The next question is for Connie. What is the biggest obstacle to getting a universal electronic record for Medicaid eligible students? Is it funding? You're on mute.
You're on mute.
Got it. Thank you, Patty, for that question. It's a great question. And I think the biggest obstacle, yes, dollars are an issue, but the ARPA funds would more than cover it. We're only talking about a couple, $2, $3, $4 million to affect over 700,000 children in the state. The biggest obstacle, I believe, is the political will for change. This is a dramatic change that will affect every school building, but is absolutely necessary because we don't have any system now, and it's causing a lot of unnecessary busy work, and also fractures care drastically. When children move schools or school jurisdiction changes from elementary to high school or whatever, those children are lost to follow-up care, and it's causing a lot of health disparities across the state. And this would fix all of those. So leadership, political will for change, I think, are the biggest obstacles. And we're continuing to advocate and educate our legislators and our BESI members so that we can drive that forward. For years, our education leaders have had the philosophy that schools can make their own decisions. Well, some things we need to centralize, in my opinion, and this is one of them. You know, we do that for all IEPs. There's a system that every special education program has to be entered into for the whole state. We should be doing the same thing for all healthcare. They're the same kids.
Thanks so much, Connie.
Yeah, I'm going to rapid fire one last question for Andreanecia. So why the jump in households struggling to afford mortgage payments in moderate income households compared to others?
So Mary, can you say it one more time? I can't see it.
Yeah. Sorry, it was sent to me via text.
Okay.
So why the jump in households struggling to afford mortgage payments in moderate income households compared to others?
Because this is how systemic bias works. It eventually bleeds all the way up. We are not dealing with the needs of the most vulnerable. So you are having a cascade effect of increase in cost of living, increase in other services that folks need, while you're having this really ungoverned and fairly ridiculous explosion in prices. So the middle class is getting squeezed. It's happening more dramatically. The folks at the bottom are in real trouble. We've seen homelessness explode for children. Chronic homelessness is staying pretty steady. We've actually seen some successes. What's exploding is first-time homelessness. Right? People, and that's a segment that we can't handle. The folks at Unity have resources to help the chronically homeless, and they're battling valiantly. And like I said, they've gotten those numbers down. But first, a lot of people don't understand that people who are first-time homeless, they can't, it takes a while. You have to be chronically homeless. You have to be street homeless for around a year before Unity can work with you, unless they have rapid rehousing dollars, which they don't have a lot of. So all of these things, and it's really this ungoverned and unrealistic appreciation and values, and our failure to, again, Connie's point about our political will to make structural changes. One thing that, and we've been talking to Judy's team about this, is with the wealth building piece. Middle class folks end up having struggles who are homeowners because there are all of these systemic barriers in place that trip them up. everything from code enforcement, disinvestment in the community, the inability to access credit, capital to fix up your home. All of those things impact on your ability to maintain that home and to have it be a wealth building opportunity. These are all a part of the disabling environment that, frankly, white Americans, white New Orleanians don't deal with. They just don't. They come to it differently, and it's things that we don't address when we create amazing subsidy programs on the front end to help people become first-time homeowners. We are still not checking on them in the long run, and so you see that the notion that, well, you were able to get a good job and graduate from college and buy a house, but we still haven't done the work because they're still African Americans. There's still Black people in the United States of America, and we've got to break down the systemic barriers at every turn. And again, it's hard because the bias, the face of affordable housing is the welfare queen stereotype. So you will have people reject. We saw this with Hurricane Ida. You had people, everybody probably saw the images of these individuals on the news saying, I want to just sleep on my property. Give me a tent and I can sleep on my property. I'll sleep in my car. And that's the rugged individualism. Your house has been destroyed by a hurricane, boo-boo. Your government should help you. You should want your government to help you, and your government should help you. But it is psychological. I need somebody to do a study on this barrier, because it's not just, it's just deep. And that's all. And that's all of the things that have bubbled up to erode at the middle class. And it gets the white middle class folks too, because they are all feeling the strain and the pressure. That is the evil, this particular evil of this stain on our society. It gets to everybody eventually.
Mm-hmm.
Thanks so much. Thanks so much, Andreanecia.
Great. Those were great questions. Thank y'all so much for responding to those. I'm going to pass it to Charmaine Cassiope, United Way's Executive Vice President and COO, to close us out.
Well, all I can say is, wow, what a compliment each one of our extraordinary subject matter expertise today have provided, and what an honor it is for United Way of Southeast Louisiana to not only benefit from the passion and the hard work that you do, but for us to be able to have the opportunity to stand alongside of you in a shared agenda that we know will not only lift up those Alice families and our hardworking citizens, but that we will focus our agenda on laser focus to being able to say that equity matters. This is so important to us, and we are recognizing at United Way of Southeast Louisiana, we cannot and will not ever be able to do this work alone. You have paid us an awesome tribute today by saying that you want to join forces with us, help educate our public policy committee, work with our board of trustees, and help mobilize all of the volunteers who are working with us to transform Louisiana. And we know that so much of that transformation is possible through effective public policy. I thank you from the bottom of my heart. You should know that Public Policy Committee will be convening on February the 18th, but I stand ready to work along each one of you as this regular session convenes in March. And I hope that you know United Way of Southeast Louisiana considers you a community treasure to us in our work to really move the needle on eliminating poverty. So God bless everybody that took time to join us, but God bless you for your passion, your hard work, and your expertise, and for sharing it with us.
Thank you so much.
Thank you. All right. Thank you so much for everyone for joining us today. We will share the recording and slides later. Thank you.
Thank you.
Thanks, everybody. Appreciate you.